Happy Thursday, everyone. We are back again. Yesterday, we actually did a complex 8-hour case, but our patient did not want to be on social media, so we respect that. It's a choice, it's not a must. Many patients want to or do not mind, but today, obviously, she doesn't mind, right? So our plan of surgery is as follows. I want to go over a few different things. Number one, she's got a V-shaped body. Okay, so this is called a V-shaped body, and her buttocks are boxy and a little bit smaller on the lower aspect, so a little bit of a V shape than a round buttocks. She has skin and fat mainly in the upper part of her body more than the lower. The lower looks fabulous to start with, and then her skin envelope is tight, so this skin is not gonna stretch to become humongous in a sense. So our plan is to do large volume liposuction. Large volume liposuction is 5 liters of liposuction in one setting in a surgery center. So what does that mean? That means that if you're operating on a patient in a surgery center, the American Society of Plastic Surgeons recommends that you liposuction the patient 5 liters only and no more. And if you decide to do more than that, then the patient needs to be monitored overnight in a hospital setting because of blood loss, fluid imbalance, shifting of the fluid, and so forth. So they want to make sure that the patient continues to do well and is monitored. So in my practice, I typically do the 5 liters, which is very safe. And then if I need to do more, then we'll do it in a second setting. Our number one goal is always to do safe surgery. There's always a tomorrow. So today, once we do 5 liters, she may need more. She may need chasing of all these rolls to the front, but I may not be able to do that because I may reach my limit of 5 liters. The other issue we have is if we are able to liposuction 5 liters, we're gonna have a good amount of fat. Are we gonna be able to put all of that fat into the buttocks? And my answer is going to be, I already know that the skin is tight. So this skin will only stretch so much. Once you reach the limit, then the fat is going to start extruding out from the incisions. Meaning that we'll probably put as much fat as we can into her buttocks today. But once that limit has reached, then we have to stop. But more than that, a back liposuction and fat transfer is not about the butt only or the back only. It's a combination. We want to improve her back view from the top to her knees or to her ankles. So it's not just about this or this. It's a combination. So once you remove a good amount of this and augment this, you bring balance to her body. You make the top smaller, you make the waistline more concave, lordosis of the back or the S shape that people talk about, and then you place that fat into the buttocks. So a combination of reduction and augmentation will actually have a far more impactful view than just one or the other. Let's get going. Just look at that. Perfectly sculpted and augmented buttocks. We removed close to 5 liters, not exactly 4.5 liters from her back, so that I have 500 cc's for the front now, where I can complete her waist liposuction. And the fat was processed, washed, cleaned, antibiotic was added to the fat, and then used to augment her buttocks. And as you can appreciate, she's got a beautiful correction of not only her buttock sagging and deflation, but also correction of shape. She has fullness and roundness that is oriented both vertically and horizontally. So we took a boxy shaped buttocks and essentially made a round buttocks or a heart shape, as you can appreciate. And then you look at her side profile. But most importantly, all of her back from the buffalo hump up here was liposuctioned with the upper back. We use these side incisions too. There's one here and one here to do her outer chest. Then we use this incision, which is normally under the bra, to liposuction her upper and mid back, and then came all the way down here. There's another incision down here that I use to liposuction her lower back, and then sculpt a lower back demarcation between the lower back and the upper buttocks, and then transfer the fat into her buttocks to create fullness. So there you go. Not bad for a day's work. So I'm now gonna turn her to the front. Just make sure that the front blends nicely with the back, and then we should be done for today.